I am here with Dr. Donald Nunn of the Beauty of Knowledge, a triple board certified plastic surgeon in Atlanta. Today I'm asking questions about liposuction. There are so many different types of liposuction that it is very hard to determine the right one for you. What are the most popular types of liposuction?
Well, the most common one is just tumescent liposuction, where you inject a fluid in the area that's to be liposuction. This fluid contains usually local anesthesia as well as a vasoconstrictor, and it's basically a salt solution. The other types of liposuction, most all types of liposuction use that technique of tumescent solution, and the difference in types are some cases they use energy such as ultrasound, or they use other instruments such as power liposuction, which reciprocates a suction cannula. But most of it can be done just with simple liposuction with standard cannulas, which are handheld and remove the fat after tumescent solution is placed. But the other ones, the laser, the ultrasonic, all those basically add energy that may help emulsify the fat so that it can be done more easily in areas where there's a lot of fibrosis and things like that. But the basic principle is the same no matter what technique is utilized.
What type of liposuction do you do, and why do you choose that one?
Well, I generally do just a standard tumescent liposuction because in my hands I feel like I get good results. I do some pre-tunneling with basket cannulas, then post-tunneling with basket cannulas to help contour the areas. I've utilized the ultrasonic and other types of energy placement, but did not see significant improvement with those issues, and I worry about getting pigmentation changes in the skin and possibly skin burns. So I tend to go with the standard tumescent liposuction with standard cannulas handheld. I've also used a power-assisted liposuction, and that is also useful in some cases, such as gynecomastia or real fibrous tissues in the back and flank areas.
Well, how do you perform liposuction?
Generally, we use a general anesthetic. Some people use local anesthesia. If it's a very small area, I'll try local anesthesia alone. But I find it is uncomfortable for the patient in the majority of the patients that I see. So we recommend general anesthetic. It's outpatient surgery, and we make small stab incisions in creases and hidden areas away from the actual site of liposuction, placed a tumescent solution, and then liposuction area. And we can do up to 5 liters at one time. We generally don't want to do more than that in an outpatient setting.
Okay. Who's the best candidate for liposuction?
The best candidate is probably someone that just has areas that they can't remove by diet and exercise, and those are the best ones. It's not a weight loss solution. You can contour patients that have managed their body as best they can without liposuction with diet and exercise, but the liposuction will just help contour areas such as the abdomen, hips, and flanks in men, and the lateral thighs in women, and other areas that are just difficult for the patient to remove on their own.
Does liposuction get rid of cellulite?
Nothing gets rid of cellulite to my knowledge. There are some experimental things that aren't tried and true yet that may be useful in the future, but the cellulite is due to fibrous attachment to the skin, with fibers between the fats, septi, and that is something that you can't get rid of with liposuction alone. Some cases liposuction may make it worse, in some cases liposuction may improve it somewhat, but to my knowledge, standard liposuction at this point in time is not a cellulite solution.
I heard that sometimes when you have liposuction, the fat will come back in a different area. Is that true?
Well, if the patient gains weight, they're going to gain weight wherever they have fat cells left. If there are fat cells in another area of the body that wasn't liposuction, naturally that's going to fill with fat, because the cells that are there are going to hypertrophy and appear larger. But even in the areas where liposuction, you don't remove every fat cell. Those fat cells that are remain in the area that was liposuction will also increase in size if the patient put on significant weight.
Okay. What is the recovery time after liposuction, and how long before I can go back to work?
Well, most patients with liposuction have a very rapid recovery. I mean, sometimes up to just a few days. I've had patients that I've done on Fridays that have been able to go back to work on Monday. Now, every patient is different in their pain control and discomfort control afterwards. But most patients, I recommend, as soon as possible, they can do whatever they feel comfortable doing. There's no open incisions other than small stab incisions with liposuction.
Okay, so those are the only scars I'll have?
Yes, I mean, generally, sometimes we do liposuction in combination with other procedures such as a tummy tuck and things like that, and naturally that procedure is going to be the limited factor, not the liposuction itself. But if you do isolated liposuction, there's very little downtime, and you're not going to hurt anything by moving around and doing activities as you can tolerate it. Usually it's the discomfort level that keeps people from doing too much afterwards.
What about working out?
I tell patients if they feel comfortable and don't hurt tremendously, they can work out as soon as they want to. I don't see any downside to that, and sometimes I feel like that helps. It's kind of an auto-massaging by working out, and I feel like that they do well with that.
Great. Well, I appreciate your time. If you have any further questions or would like to set up a consult with Dr. Nunn, you can call 404-255-2975.